Welcome to the office. Hi, Anna.
Hello.
Welcome back.
Thank you. Good
So,
to be back.
Good to see you. We're on visit 3.
I think it's 4
4.
now.
No, we're on visit 4. So, what happened since our last visit? That's right, it is visit 4. Welcome back.
I noticed the things that weren't aligned before, like my jaw before it was like this way. It's more even now, which is really crazy.
Your jaw feels more even.
Before, when I open and close my jaw, it kind of felt like it's like full on impact and I have to like wiggle it to the side. Now it kind of feels just like.
Is it closing a little easier now?
Yeah.
Oh, nice. Can we see?
Yeah.
Sit up straight, scoot forward a little bit, and go ahead and open, close. Open, close. So it's sliding in now.
Yeah.
Open again, please, and close. Okay. So this feels a little bit better.
Yeah, before I had to like put on a lot of force and even my hand to push things into place.
And for the last few days you haven't?
No. Yeah.
Awesome. Cool. What else?
And then this bone over, what is this bone called? It's like right below the collarbone.
So we have the clavicle here, okay? Then we have the sternum.
Oh, okay. So
the sternum is the center bone, and then the ribs attach into the sternum in the front.
Okay, so this one, before the right side has always been a lot more protruding. Now it's a little bit more even.
Okay.
And then same with like my rib cage, my left side looked like there was an extra rib or two. Now it's way more even.
So you felt the left was rotating forward and you could see
or like
it.
Maybe even down.
Okay.
Yeah.
And now?
Now it's way more even. Yeah.
That's awesome, dude.
It doesn't look like there's an extra rib on the left side.
Okay, cool.
Yeah, it's kind of crazy because I don't feel I guess I don't feel the difference in effect too much, but I can see it.
Interesting.
Yeah.
And you know why part of that is? Well, part of it is you're taking some time off to work, right?
Yeah.
To work on you. Part of what I want you to focus on and learn in this process, and I will make some recommendations of a few books I'd like you to read.
Okay.
Okay? And it's about self-awareness. And the first thing is the breath work. So the first homework you're going to start today is diaphragm breathing or diaphragmatic breathing. And you can look it up on YouTube. There are millions of videos out there. It's whoever you'll connect with, and you can actually watch the video and do the breath work with them. So it's diaphragm breathing, breathing from your stomach. Why do I say that? Because there's one physiological difference between anxiety and excitement, and it's the breath. Okay, that was discovered by, what was his name? It was a psychologist years ago, and the name is not coming to me, but it'll come to me, and I'll get it for our next visit. And the idea is, whenever we're feeling that anxiety or anxious, go straight to the breath work. Go into the fear with the breath to make it exciting. Sounds simple, I know. And you're like, no, it's not good. Just try it. Guys, just try it. It works, okay? So the other homework is getting out. You're going to go to the beach now. We have great weather. Go ride a bicycle. The other thing I like is grounding at the beach. Okay, go to the wet sand, and as much time as you have and can walk, do your walks there. You have the time now to do it.
Yeah.
Cool?
All
right. And, okay, anything else? So we got good changes.
Yeah.
Okay. Any soreness, anything new show up?
My jaw did experience some soreness, but I still think that's probably normal. So I'm not too worried about it.
Okay.
And in terms of my back, I think the problem too for me is I'm very numb to, like, for example, my feelings, how my body's feeling, or like, just very numb to sensations. So
you want me to go there?
Sure.
You want me to go there?
Yeah, I think that's also why last few times I was crying. I was like, I have no idea why.
Because you're blocking a lot of stuff from before. And the stuff needs to come out. Whether it's here, you're allowed to do it here. If you feel comfortable to do it, no issue. If we need to turn that off, we turn it off. That's not the issue, okay? Just letting you know. If you start and you're like, turn it off, it's off, okay? But you need to know that it needs to happen because you've been blocking so much stuff to the point where you're, as you said, numb. There's no feeling.
Yeah.
Okay? And I can push something, it hurts, but you don't respond.
Yeah.
Okay? And so part of those cries that are coming out is a signal and a sign for you. Your body wants to let it out. Got it? I can see it's coming out. I know. You ready?
Yeah.
All right. And guys, it's a real thing, you know, these emotions that we hold in our body, right, Anna?
Yes.
You know, and I think it was a new experience for you where, yeah, you're like, you started to release and you're like, well, I don't understand what's going on. But I'm glad it happened, started here at least. Starting at the base of the neck, head down, please. And we're getting 5 points up top, left side, 10 points, left C1, T3, T4, 5 points. That's the heart chakra, guys. Gotta open up Anna's heart, yo. Keep blocking it. Why are you blocking your heart, Anna? If you compare her posture, it's a little odd, but it's still better than first day. You're sitting better. Oh boy, T9, 10 points. Sit up a little straighter, T9. S5, coccyx left, T9, T4, C1. Those are the majors today. They're shifting.
Yeah.
Anna, they're shifting.
That's good, right?
Yes, ma'am. And you're walking, yeah?
Yeah.
1, 2, 3,
I feel a little, yeah.
5 or 4? That's 5. That's 4.
I think 5-ish.
Starting there?
Yeah.
Not there.
No.
5.
Yeah.
4, 3, 2. Relax the head for me. T5 is more liver, gallbladder. Right there. C1. All right, let's check down low, please. Back slowly towards me. That's 5. That's 1.
A little bit.
That's 2. Definitely better than first day.
Yeah.
3. That's 4.
More. Yeah. Ouch.
5, 4.
Okay.
Right there.
Yeah.
Yeah. S5, T5.
What are those?
What's that?
What are those?
T5 is liver, gallbladder. S5 is down in the sacral nerve, sacral chakra, right around the tip of the coccyx. I'm going to wait on the neck. So we're going to do T5, S5, have you walk, recheck the neck. After that, then we work on the... All right? You ready?
Yeah.
Let's do it. I'll be on the outside for you, okay? Right there. I'm holding you here. Keep your head straight. I'm holding you here. That's a baby one. I'll need to be on the underwear, okay? There. That's the home run. Walk it out. Actually, walk it out twice.
I did feel a little bit of a head rush.
From that?
Yeah.
I mean, when we're making these adjustments, let's go face down, we're resetting the nervous system, right? And let's go face down. All right, T5. T5 we're going to set as a PL-T. 2, 3, 4, 5. How is he doing it from the opposite side? Perfect. That's the home run, lady. Okay. I'm going to do a little more of the tailbone, okay, here? There. Just a bit with a torque. Just a bit. There you go. Awesome. Awesome. The reason I waited on the neck, because we know there's a reverse curve, and I know that we need to work more on the lower neck. So this is going to show us if it was compensating from whatever was happening down below.
Uh-huh.
Make sense?
Yeah.
Have a seat. All right. Look at how she's sitting now. Voila. And you got your yoga ball and disc?
Yes.
Awesome. Starting at the base. Yep. Bottom one showed up, C6. And the top one cleared. Ha! So if I would have done your upper neck, it would have been wrong today. Mid back is clear. All clear. Clear.
Oh.
Check it out. All the way back.
Oh, yeah. Huh?
Oh.
What?
Hey. Hey. Good?
Yeah.
Yep.
A little bit there, but...
A little sore.
Uh-huh.
Okay. You ready?
Four.
Let's do the neck next. Sit back for me, please. And we're going to do 2, 3, 4, 5, 6, 7. 7 is a PLS. Okay. Left ear. Chin back. Chin down. Relax it for me the best you can. There you go. Now, she has a longer neck. She's flexible. We've got to lock out that 6, 7 right there. There you go. Gotcha. Scoot to the left a little bit. Just want a tiny bit more of that, okay? Tiny bit. Chin back. Just a tiny bit. Right ear down. Actually, let me do it. There it is. Good. That's the rest. You ready to go deeper on the jaw today?
Yeah.
Ready?
Uh-huh.
Cool. She's like, I'm here. I got the time off. I better do it. Sooner than later. Let's use the condyle block there. Back, look up, slowly open. It is better. Slowly close. Slowly open.
Hold on, it's still a little stuck.
Okay. Slowly open. Okay, open all the way. Close halfway. I'm pushing on the right. Tell me whenever it's too much. 4, 3, 2, 1. Open. Close. All right, we're going in there now, okay? Same thing as I tell everybody. If it's too much, just raise the hand. I'll stop. Okay? You ready?
Yeah.
Okay. Head back onto my hand. Open the mouth. And I'm starting at the TMJ. I'm getting into the pterygoids and masseters. I'm not looking, me personally, I'm not looking just for a tight knot, okay? I'm looking for a knot that has some energy right there. Right there. That's where she's holding it. 5, 4, 3, 2, 1. Now I'm going to go a little bit more there. There it is. And let's get it out. Right there. Lean back into my hand. There. 1, 2.
I don't know why I felt it in my feet.
Seriously?
And my right foot.
That's a first. I'm going to do a little bit on the left now. Is that okay?
Yeah.
Okay. Head back. Open. Now, there's a lot more on this side. A lot more. It's personal, lady. It's not career. Oi. Lean back, come on. There it is. Neck is clear. Sweet. And if you watch her posture, she's sitting better right now. When we're done here, Anna, I want you to go for a nice walk, please, okay?
Okay.
Please. All clear there. I'm going to do a little buff and polish for you now. Deep breath. Now, I want you to breathe in and push your stomach up. Deep breath in. Hold, release. So what I want you to try now, do it yourself, hands on your belly button. You're going to fill up your tummy. As soon as you feel your chest start to move, stop. And then blow it out. Deep breath in. Lift the tummy. Push it out, stop. Exhale, belly button in and up. Deep breath in. Deep. Exhale. Deep breath in. Exhale. Deep breath in. 2 more. Exhale. This is diaphragm breathing. Deep breath in. Come on, push it out. Push, 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 push. Exhale. 1 more time. Deep breath in. Exhale. We're going to leave it at that, okay?
Okay.
All right, and I think, no, you stay there.
Okay.
I think you need to release something, but we're going to stop it right now. Okay, go ahead and stop it.